Hi, I'm Dr. John Douillard, and welcome to LifeSpa.com, where we prove the ancient medical wisdom of Ayurveda with modern science. In today's episode, we're going to talk about seasonal respiratory irritation, those pesky, irritating, itchy eyes, the runny nose, the hay fever, the chronic cough, the postnasal drip. All of these things are caused by a histamine reaction. So what is a histamine reaction? Well, it's an immune event that takes place inside of your lymphatic system. Now, on the other side of your skin, inner skin and outer skin, you have lymphatic vessels, right? Because your lymph system is trying to carry your immune system. And inside that lymphatic system, inside that immune system, is that histamine reaction, which only reacts in an overzealous way when the lymph is somewhat stuck in traffic, right? So on the inside of your respiratory tract, you have a type of epithelium called inner skin. On the other side of that, you have what's called the respiratory associated lymphatic tissue. Inside of your intestinal tract, you have what's called the skin or the mucous membranes that line your intestinal tract. On the other side of that, you have the gut associated lymphatic tissue. Right here, we have our outside skin, but on the other side of that, we have our skin associated lymphatic tissue. Sometimes as a result of an immune event, you can get hives or rashes or things like that because the skin is becoming reactive to the congestion of the skin-associated lymphatic tissue on the inside. So for us to deal with these seasonal irritations, these pollens and pollutants that irritate the inner skin on a chronic basis, creating congestion in the lymphatic system around it that drains it, we have to decongest the lymph and also support the integrity of the inner skin itself, right? So that's why we get these seasonal irritations, hay fever, and so on, is because of these pollens and these pollutants irritate the lining of the respiratory tract. That creates a level of inflammation. Those toxins get pushed into the respiratory associated lymph. If that overwhelms that lymphatic system, it can create congestion in the lymph and therefore a histamine irritating reaction. The best food to handle that are what are called bioflavonoids. Bioflavonoids are these kind of powerful antioxidants that are in many of the foods that we eat that actually protect the lymphatic system, support a patent flow of the lymphatic system, and really stop the hypersensitivity reactions like a histamine reaction that takes place within your lymphatic system. Some of the greatest source of bioflavonoids is in the peels of citrus. I've written a handful of articles on the science of eating the peel of an orange, the peel of an apple, the peel of a grape, the peel of a pomegranate, or even the white pith of a mango. All of these are loaded with bioflavonoids, and there's lots of really good science behind the benefits of these bioflavonoids. Yes, they're in the fruit itself, but they're way more prevalent in the actual peel. Now, this article is not necessarily about you taking the peels of these, but I wanted you to know that traditionally, the peels were something that were consumed along with the pulp, with the fruit itself. You know, one study showed that the citrus peel, the bioflavonoids in the peel, have been shown to boost immunity and detoxification for the lymphatic system, supporting a healthy, functional, and flowing lymphatic system, therefore immune support. There are two particular bioflavonoids that have been well studied called diosmin and hesperidin, and they've been shown to increase microcirculation, venous drainage, and lymphatic support. They've been shown to help heal the inner skin of your intestinal tract, supporting a healthy response to inflammation or hemorrhoids in your intestinal tract. The research on that is quite amazing by these only two of the many, many bioflavonoids found in the citrus peel. One of the more common bioflavonoids, something called quercetin. Quercetin is, like all of these, a little bit harder to digest, but they're found in onions and apples and berries and brassicas family vegetables, nuts, wine, black tea. All are loaded with this bioflavonoid called quercetin. Now, the problem with quercetin, because it's one of the most powerful for kind of neutralizing this histamine reaction, is it's much somewhat difficult to actually digest or absorb or assimilate. And that's the problem with quercetin. It's been used forever and ever in natural medicine to help support hypersensitivity reaction due to seasonal irritation. But the more it can be created in a way that's easy to absorb, it's been shown to support that histamine response in a better way. Studies show that quercetin can actually decrease the lymph-based histamine reaction directly. It's been shown to decrease eosinophil recruitment, which is the white blood cells that is responsible for the histamine reaction. And it's also been shown to decrease what are called pro-inflammatory cytokines, which are also responsible for lymphatic congestion and that histamine reaction. So because quercetin is so hard to digest, and the more that you can get across the intestinal lining into the bloodstream, the better. Studies have been shown to actually increase the bioavailability of the quercetin. So instead of just eating your orange peel, which I still do recommend, or throwing a whole lemon in a smoothie, or the whole orange, or eating the whole orange together, I think it's a great and natural way to get your bioflavonoids the way we were designed to get them. But studies show that when you actually take the quercetin and you combine it with what are called phospholipids, it's been shown to the phospholipids, which help cross the phospholipid layer of your lining of your intestinal tract into the bloodstream. It increases the absorption of the bioflavonoid, the quercetin, by 20-fold. Studies show that in cases of respiratory irritation, where folks just took 200 milligrams of the phytosome quercetin, they found that there was a significant reduction in sneezing, eye irritation, eye itching, runny nose compared to the placebo. So if you struggle with seasonal irritation, we should think about a couple of things. One, quercetin is a way to make sure that you get that quercetin phytosome, which is a way to make sure you get that quercetin into your lymph to help support that lymphatic flow and knock down that histamine reaction. That's number one. Number two, though, ask the question, why is my lymphatic system congested enough that it's actually backing up irritants in the lining of my intestinal tract or in the lining of my respiratory tract, and therefore creating that hypersensitivity reaction? And that's where you want to look at lymphatic congestion directly. And there are many herbs that support lymphatic flow, like mangista and red root. We have something called lymph cleanse, all really effective for lymph support, but also recognizing that the upstream cause of all lymphatic congestion starts inside your digestive tract. And I have an article on our website at LifeSpa.com called the Digestive Health Quiz, where you can go through and take the quiz and find out where in your digestive system you may have a weak link. And if that weak link is there, that could be responsible for undigested proteins and fats going into your intestinal tract completely broken down, where they irritate the lining of your intestinal tract. They create inflammation in your intestinal tract and find their way into the garbage can. And the garbage can for your intestinal tract, I wish it was the toilet, but it's actually the lymph on the outside of your intestinal tract. And when that gets congested, that lymph congestion can become systemic, and there's where you get your food intolerances and your histamine reactions and your seasonal irritation reactions as well. So lots to learn here at LifeSpa.com, where you can get all this information for free. There's article after article after article about the lymphatic system, even more articles about how to troubleshoot and reboot your digestive system, and that's where you get to the upstream root cause of seasonal respiratory irritation. Thanks for listening. I'm Dr. John Douillard. Hi everybody, I just want to take a minute and tell you what we do here at LifeSpa.com. You know, I've been in practice now for 40 years, 38 of them have been practicing Ayurvedic medicine full-time. For the last 20 years, I've been writing articles and doing videos on the ancient medical wisdom of Ayurveda with the modern science. You know, if something's been around for 1,000 years, still practiced today, and you have modern science to prove it, boy, I really feel like that's something we should all be taking a look at. And that's what we do at LifeSpa.com, and all that information is for free. So just go to LifeSpa.com and search in your health topic, and you'll get the information, the article that you need, hopefully that will help you. While you're there, check out our Ayurvedic store. You can get there through LifeSpa.com or go to store.lifespa.com. And there we have all of our organic Ayurvedic herbs, organic skincare line, more books, tapes, knowledge that we give you is all there at our store. All of our cleansing kits are there in our store. All of our herbs are whole herbs with the natural occurring microbiome, the way it came out of the soil. And that's critically important because if I took the bugs out of you, you'd be completely different. We take the bugs away from a plant, like sterilizing and making an extract or spraying your food with pesticides, you lose significant benefit of that plant. And that's why we use the whole plant with the natural occurring microbiome. So check us out, learn more about what we're doing here at LifeSpa.com, and we'll see you again.
This recording is brought to you by LifeSpa, where ancient Ayurvedic wisdom meets modern science. Get access to free health video newsletters by Dr. John at LifeSpa.com. These statements have not been evaluated by the FDA. These products are not intended to diagnose, treat, cure, or prevent any disease.